I'm going to start with a couple of questions and also get to some audience questions as well that people have put in the chat box. But I'm just going to begin. When Insight opened in the early 2000s, it was kind of a compromise because what people were really pushing for was safe supply. So there were still street drugs being brought into that context. There have been studies like Naomi and Salome, where the sort of medical research studies have been done, but the expansion of the safe supply runs into these regulatory hurdles, as you mentioned. I'm just wondering if those of you on the panel could maybe just speak to if there was one or two things that the government could do right now to change the facts on the ground that would benefit people who are drug users. What are some of your policy ideas that you would put forward? So if any of you want to jump in, maybe I'll just start with Susan first.
I would immediately expand heroin-assisted treatment and make it a more flexible program. Right now, when we have Crosstown Clinic and a clinic in Surrey providing that, I would also rethink, why does someone have to be diagnosed as having opioid use disorder in order to receive IOD or OAT? And this is because we have no conception of a recreational or occasional user or weekend user. We have these ideas about addiction and the addict that are really faulty. And I think we need to have a larger discussion. I know that doesn't do anything overnight, but a larger discussion on the idea that when people use regularly, we don't need to criminalize or pathologize that. And ultimately, I'd like to see us decriminalize personal possession, but I don't want us to then just focus on drug traffickers, as a Canadian police chief have just recommended, because oftentimes people who use criminalized drugs sell a bit of drugs in order to support their own use, or they pool money with friends in order to buy. So I think that's really an avenue we shouldn't pursue. But certainly, I think decriminalizing personal possession is vital, as long as we continue to have the conversation of dismantling prohibition in all of its entirety. And to keep up the conversation about resistance, social justice, that people who are the most affected should be at the table creating this policy.
Yeah, thank you, Susan. Garth, did you want to jump in on this question? If you had some policy ideas that you think would have immediate impact on the ground?
Sure. I mean, one of the things of this talk was to compare COVID and the overdose crisis, and so I agree with what Susan just said. And one of the reasons the government has told me that we can't expand heroin-assisted treatment is because we can't get the heroin. I mean, I said to them, I could help, but actually, and that's not even true. It's very rare right now to find real heroin. But they mean, and we mean, pharmaceutical grade diacetylmorphine. And it's true, there's kind of complicated reasons, but it's mostly the government won't just say, look, here's a couple $1 million to a pharmaceutical company, just start making it, right? There's pharmaceutical companies, on the North Shore of Vancouver. My ex-partner used to work in one, like on the assembly line there, watching pills go by all the time. So like we know how to do this. And then in the beginning of the pandemic, Premier Horrigan said, well, if we're short of masks, like PPE, like N95s or whatever, we have the pulp and paper industry here. We'll just make them in BC. So, the government was even willing to say, we'll make it. We'll make this thing that's needed. But they don't put the same urgency. So we need a national strategic heroin reserve. We need governments, just like in World War II and just like they were proposing to do in COVID, to actually lean in and say, yeah, we'll have this thing manufactured here. I mean, that's one simple thing. On decriminalization and cops, Horgan's gaslighting everybody by saying he's writing to Trudeau to ask for decriminalization, and Trudeau isn't ready and doesn't want to do it. And this is like a classic Canadian pastime of point to the other level of government. I'm fucking so tired of this, man. And what he's got to do is he's reviewing the Police Act right now. And this isn't even a radical proposal. Bonnie Henry said, amend the Police Act to make sure that, drug users don't get harassed for possession or whatever. by the cops, don't get arrested. And Horgan said he won't do that, but he's made this committee to review it, the special committee to review the Police Act, even instructed them not to do it. So he's got to turn around on that. But that's a lot of gaslighting from one guy right now. But I also agree with Susan that we don't want a police chief's written drug policy, right? So when Adam Palmer, the chief of police of the Vancouver Police Department, goes out with all the other chiefs of police and says, oh, okay, we're for decriminalization, also asking Trudeau, a guy who doesn't want it, and they know it, we got to be suspicious, because this guy could have been implementing de facto decriminalization himself, and the VPD could have since the last crisis. They have chosen not to. They're still chasing people around. So, if he wants to go have a system that relies on ticketing and people not meeting conditions, like red zoning we've had for a long time, then yeah, that's what you're going to get. So don't let police chiefs write your drug policy.
Thank you, Garth. Angel, did you want to jump in on this question? If you have any policy ideas in terms of how things would be supportive of drug users in the neighborhood that would make things safer on the ground. Oh, Angel, I think you're on mute.
Sorry, I think decriminalizing possession first and foremost, obviously that's important. I think better pay for the frontline workers and the peer frontline workers working in the opioid or in safe injection sites. And I think making it so that safe injection sites are open 24 hours with safe like with clean gear and whatever. I think that would be a really good step towards helping. Then people like myself, they want to keep, barring gas, we wouldn't have to worry so much if there was somewhere for people to go, and also maybe remove that condition off of the SROs and give us our rights back. And yeah, but first and foremost, decriminalizing possession. And also, like Susan said, really watching out for how you're doing that with because there's people that do sell drugs that are only selling drugs just to get keep their own habit going, not to get rich. So,
thank you. Mark, did you want to jump on this? You're working inside of a bureaucracy at Vancouver Coastal Health, and you certainly see regulatory and policy things get in the way of public health outcomes that everybody wants. And I think it'd be really interesting to get your take on what could be moved on really quickly that would change things on the ground.
Yeah, well, I mean, I don't know if it's quick, but Canada knows how to legalize illegal drugs. We've just gone through that process with cannabis, and I think it's actually been quite successful. So, we have the model to do it, and now we have to do it with the drugs that are actually harming people instead of the ones that aren't. But because the kind of safe supply programs that are being proposed will never be sufficient, because we don't have the pharmaceutical alternatives to all of the drugs. And so we need to create safe versions of all the drugs. It's really the only acceptable thing. But if we're not doing that, then we do need to work on the safe supply programs. And the kind of barriers that we're running into is the only kind of model that seems to be acceptable to people right now is one where there is individual physician prescribing. And, we think with the right protocols and the right assessments and things like that, that wouldn't be necessary, that you would be able to come into a program where they have the protocol and they do a nursing assessment or a peer assessment, and then they kind of move them through the safe protocols that have been developed. And that's just not acceptable to kind of governments right now. And so the only models that are being considered are this individual physician prescribing a medication. And then, the options of what drugs are being provided are extremely limited. And, that limits who even wants to be part of the program, because they just can't have the options they want. So there needs to be, all of the pharmaceuticals need to be available, just like when you're in a hospital, the physician can prescribe any of the medications to you that you need. That should also be the case in safe supply programs. But just to kind of respond to what Garth was saying, I mean, the main barrier to injectable opiate agonist therapy programs in the province is really the cost of those programs. I don't think it's about the logistics of importing heroin in from Switzerland or developing, local production in a pharmaceutical company here. I think it's really about the cost that it takes to have a program and, to prescribe that injectable medication to somebody on a daily basis. It is expensive, but again, the cost argument doesn't really make sense because we of course spend lots of money in the healthcare, area on patients to have transplants and to have all kinds of things. And so cost doesn't seem to be a barrier for some conditions, but seems to be an insurmountable barrier for other conditions.
Yeah, thank you. There's a number of questions that have come in on the chat. I'm just going to read 3 or 4 and then come back to any of you if you have a comment on any one of those. What did the speakers feel about the defund the police debate? Would that help the community feel safer? A question as well, would a government-appointed ombudsman be an authorized coordinator to anticipate, get around, modify barriers to be more efficient, effective with plans? What is Vancouver's role in ensuring the rest of BC has their needed drug-related services, the rest of Canada? How can people assist in lobbying the government? So we have a lot of people that are mobilized on this call and really want to help out and be supportive of this movement. What can people do to support? Maybe I'll start with you, Susan, if you want to answer any of those.
I guess I'll start with the first one, the defund the police. I think we need to look at just how policing is organized and constructed in Canada, all levels of law enforcement, to look at those budgets, to then look at our budgets for housing and social supports, annual incomes for Canadians. Those kind of issues are important. You could defund the police, but they're still practicing in ways where they're racial profiling poor and Black and Indigenous people who use drugs. So I think more than defunding has to occur. But certainly, if we put more of our tax dollars into social supports and providing safer supply and harm reduction programs, sanctioning heroin compassion clubs, testing of drugs while we move through this transition, all of that would be worthwhile. And yeah, I think lobbying your politicians and the government is always a good thing, to be verbal and to resist what's going on and to provide alternatives to what the status quo has become. Because really, it's unfathomable in a certain way how we could allow so many people to die when these are preventable deaths in relation to the overdose crisis.
Yeah, one thing that comes up for me is in the late 90s when the public health emergency was declared, the Vancouver Agreement was signed where the 3 levels of government were partners, and additionally the health authority and the police became signatories. So there's a way to talk past those silos a little bit to come up with some workable solutions. Those cause problems and they lose their bureaucratic inertias over time, but you haven't had similar types of agreements in the context of these health emergencies. So I'm going to pass it over to Garth if you wanted to weigh in on any of those questions.
Sure, I'll be quick. Defund the police? Hell yes. Government approved ombudsman? I don't know. Vancouver role in helping the rest of BC? I mean, people got to organize wherever they are. They got to organize. Drug users got to get together, form a union, organize. Like, I don't think everybody else wants Vancouver like vansplaining the solutions, especially when we haven't found them or we haven't been able to win them. We've been able to make some incremental gains, but we're still far away here. So maybe Vancouver ought not to be telling anybody else how to do their business. And then the last thing, how can people help? The most immediate thing I can think of is if you're in Vancouver, on the 15th of August at noon, come to Main and Hastings. We're having a rally for all of the people that we've lost. But it's not just mourning, it's angry and fighting back. And, we're still discussing what the most appropriate civil disobedience action to take on that day will be. But that's kind of trying to recover some of that radical fighting history. So yeah, come to that.
Angel, did you want to weigh in on any of these questions?
Yeah, I think as far as defunding the police, that's a touchy one. I'm like, not about the police at all, don't get me wrong. I think that like we should really be focusing on like what kind of calls they make. Like police are needed. We couldn't police ourselves. There would be absolute like chaos in the world if that, we'd go into anarchy really. I think we need them, but we need health professionals, mental health professionals to go and answer mental health calls. Police need to take sensitivity training, cultural sensitivity training, and they should have to do a week or two or even a month in living in one of the SROs in the downtown east side, getting to know the people, or at least once a week doing something to get to know the people, because they suck right now and they're not doing very well. I don't know. And then I don't know about the ombudsman thing. I think, so yeah, there's somebody, decriminalization and safe supply are the way to go. And remembering that people are like, that's why I think police have to take trauma, professional sensitivity training is because, and professional ethics something, is because they're not looking at the whole picture of the person. A lot of people that are doing drugs are traumatized people, and they grow up and, that's what they're using drugs for. And so they're hurting people that are already hurting. They're beating the crap out of them. I see it every day up there. In Hastings. So yeah, that's that. Thank you.
Yeah. Mark, did you want to weigh in on any of those questions?
Sure. Well, I'm going to agree with Angel that we have to change the way that police do their work, or change even who police are. I agree that many of the situations they're responding to are mental health situations. They admit that they feel completely unprepared to respond to them. And so we need to change it so that the police are not all police officers, and that there are mental health workers and social workers that are part of police forces, and that they work together, with the more security elements of the police when they're needed. No, Garth is saying no. Anyways, but I don't know. I think we have to change the people that are responding to the problems, and the issue of the ombudsman, I would say we essentially have that now. They created this Minister of Mental Health and Addictions, and created this very, very small ministry that she would be in charge of. Yet she is not in charge of healthcare funding, even for programs related to mental health and addictions. So we have somebody who's sort of a figurehead who can advocate for things, but with no budget behind her to implement programs. And so we find that to be one of the major barriers that we run into in the healthcare system. It's still the Ministry of Health that controls all the funding for healthcare programs. And that's just a huge problem. It allows the Minister of Health not to feel responsible for this problem, because there's another minister who is responsible for it. And we don't really get any progress. In terms of the Vancouver, in Vancouver, we have been able to develop and implement and research harm reduction interventions that they've not been able to do in other parts of Canada. And so I think it is our responsibility to implement those programs when we can, and to study them and to publish the results. And that, has definitely been very important around all the research that was done around insight. More recently, we developed drug checking as an intervention that could play a role in the overdose emergency, and it's been adopted across Canada and across other places. So I think it is our role to do harm reduction, to do research around it, and to, help give ideas to other places. Now, I agree with Garth that the Vancouver downtown east side solution is not the solution for every community, but there are ideas there that can be used and have been adopted. And now, particularly with overdose prevention sites, I think we're seeing, there is the insight model, but this can be done differently in different places where there are different needs, where different people are involved. And we've seen a lot of kind of specialization in overdose prevention services when you don't have such a heavy regulatory regime on top of you that doesn't allow you to make changes. So, we've seen women's only overdose prevention services in hospitals. We've seen them in rural areas, so we're seeing a lot of innovation around things that were initially kind of studied in Vancouver.
One of the questions that came in clearly is a province-wide issue, and with so many people dying, the effects on loved ones, parents, sisters, brothers, friends? What are the supports that are available for people who are impacted by the deaths that happen? And there was another question around what is the distinction between decriminalization and legalization? So if somebody could weigh in on that, I'll maybe just start with Susan again.
Okay, I'll start with the decrim legalization. If we decrim simple possession, that leaves the whole drug trade still intact. And so it means that people are still receiving or buying drugs from an illegal market, which is unregulated. And as we know with the overdose death crisis, that drugs sold on the illegal market, we don't know the quality of those drugs, and often they have adulterations in them. And that's why people, overdose from these drugs, because they don't know the quality of the drug. So it leaves that whole, and it leaves in some ways this sort of punishment industry intact as well, around ideas about good and bad drugs and importation and production of drugs intact. Decriminalization just means that you're not going to be criminalized for this small personal possession. It would mean a lot. I'm not trying to make less of that. I mean, even in BC or in Vancouver, our latest drug stats, crime stats, 72% of all drug offenses were for possession. So it would, be quite vital to decriminalize possession of drugs. But it's to say it really doesn't get rid of a larger issue, which is access to safe drugs and sort of a questioning of global prohibition, national prohibition. In terms of groups, one that springs to mind, of course, are all the drug user unions that exist throughout Canada and British Columbia itself, but also the mothers organizations, Mothers Against Prohibition, that exist too. And I refer to those groups because those are people who themselves have experience in relation to the use of drugs, but also experience in relation to loss and death, in relation to our policies. And as Angel said, see themselves as not just drug users. There are people who have been impacted negatively by our drug policies, but they're obviously engaged in all other types of life, like everyone else is who isn't using criminalized drugs.
Thank you, Susan. We're running out of time, but I'm going to give the rest of the panelists 1 minute each to wrap up or weigh in on this question. I'll go over to you, Garth.
I don't know what to tell you about supports for grief. It's been fucking me up lately. Like I'm carrying it around like a stomach full of concrete. I don't know what to do. I mean, I'm the last person to give advice on this, really. I've been just cramming it all down there and sort of trying to numb it out. So yeah, don't listen to me about that. But do listen to me about defunding the police, because really, like, the police have to be defunded. We have to recreate society. We have a society that was built on a whole bunch of racist institutions, a whole bunch of capitalist institutions. If we want to get rid of the drug war, if we want to transform systemic things, it doesn't just mean absent one institution. Like, we're not just saying minus the police, it's saying take some of the functions that we think of when we think of the police and do them with somebody else. Do them in a different way. You start cutting that all down, you see what's left, see what nobody else can do, and I bet you're going to find a little sliver. You start changing other things in the world, that sliver disappears too. No more cops. Thanks for having me, and thanks everybody.
Thank you, Garth. Angel, over to you.
That'd be a great world, no more cops. I can't tell you either. Like Garth, I deal with my grief by my writing or by doing work on my, in my groups or whatever it is that I'm doing. Like, I really, there's just so much of it. I know there's those mothers groups that Susan was talking about, Al-Anon. I really don't. I don't know. All I know is for myself, I deal with it at home on my own, and I stay close to my friends, and that's how we do it.
Yeah,
Thank you.
I would
Go ahead, Mark.
agree. I would agree that the healthcare system really doesn't have the right supports for grief, for trauma, for pain. It's very hard to get supports for any of those problems. You can get more if you have private insurance through work. That's where a lot of those supports are given, or you get some supports for these issues if you develop a mental illness because of them. But again, like, we shouldn't be waiting until people develop illness to address the root causes. So I think that's really a problem. But I would like to give a shout out to organizations like Moms Stop the Harm, because I think turning your grief and your pain into advocacy is powerful. And I think that organization in particular has made a difference. And I think when you can feel like you're part of the solution, it does help address some of the pain that you might be feeling. So I think that is actually a good approach to the problem, but not everybody will be at a stage where they're ready to do that.
Thanks so much, Mark. And I wanted to thank Susan, Garth, Angel, all of you for sharing your stories and your perspective. This is an issue that's going to take sustained energy to move the dial on public policy. So really view this as the beginning of a set of conversations that are going to require focus and attention to move the dial in a way that really does shift the facts on the ground. So thank you so much for taking part. I'm going to pass it back to Doug from Public Square.